Welcome to Mental Health is Health, our community conversation today. CBS News Colorado and MTV are partnering with one goal: to improve the mental health of everyone in our community. We are excited to bring together some of our state's leading experts on this topic to dig a little deeper into the behavioral health issues that are affecting so many of us Coloradans. Joining us is Behavioral Health Commissioner for the state of Colorado, Dr. Morgan Medlock. Dr. Medlock, thanks for being with us.
Of course, thank you.
The Chief of Mental Health at Children's Hospital, Colorado, Dr. Ron Lee Liao. Thank you so much, Doctor, for being with us.
It's a pleasure to be here.
And Steve Hayden, who is with Envision You, a nonprofit focused on improving behavioral health for Colorado's LGBTQ plus community. We really appreciate each and every one of you for being with us and spending this really important time. Thank you all. So Dr. Medlock, we want to begin with you. You will be heading up the new Behavioral Health Administration. It's one of the most ambitious efforts to reform the delivery of mental health in our state's history. You've said that people really need a front door to access care. So how does that happen? Explain that to us.
Absolutely. Well, I am extremely excited to be the first Behavioral Health Administration Commissioner for the state of Colorado. This is certainly a historic moment. And one of the things that the Behavioral Health Task Force, which actually made the recommendation to Governor Polis that an administration be established, one of the first things that they thought was critical is that we establish a front door to treatment, and specifically that we think about that in terms of expanding and building upon our crisis services system. So when we think about an expanded front door, we have done a lot this legislative session to ensure that when the people of Colorado need help in an urgent way, that they're able to get the care they need. Some of the bills we've been able to get through this session are really historic in that they ensure that youth who are in crisis are able to be seen in our crisis system. They ensure that individuals that are experiencing substance use disorder crises are able to be seen, that they don't have to go through a different front door than a person that's experiencing a mental health challenge. And also individuals with disabilities. We clarified this legislative session that all of our crisis centers should be equipped to serve those that may be experiencing a disability. So this is really a historic moment for Colorado to build a crisis services center that is able to really meet people where they are and also connect them to the continuum of care.
Yeah, so Dr. Medlock, this is so important as we move forward. As we move forward with all of this, you have to have that access, right? People have to know where to go and that there is a place to go to that will allow them to get the help that they need.
Absolutely, that's right. And so one of the things that we are also looking at is that we know that we have to combine the front doors to our walk-in centers, our crisis services centers across the state with digital solutions as well. And so look forward to talking with you a little later in the broadcast about our new care directory that we will be launching the first month of our administration in July 2022. Very exciting.
Yeah, that's awesome. That's wonderful, wonderful news. Mr. Hayden, your organization recently released a State of the State report on the concerns and the experiences of LGBTQ plus individuals. What stood out to you the most in that report, and were you surprised by what stood out to you? The first question.
Sure. Thanks so much, Karen. Really appreciate the opportunity to talk about the mental health and wellness of the LGBTQ community. And, it's important to note that there isn't inherently a greater risk for members of the LGBTQ community in experiencing mental or emotional health concerns. But given stigma, discrimination, pervasive trauma in the community, we do see higher rates of poor mental health outcomes and often less access to affirming care. And so across the board, the statistics altogether not surprising, and they mirror those that we see nationally. A couple that I think stood out for us is about a third of the community in Colorado has experienced disordered eating, which is one of the leading causes of death among LGBTQ folks. High numbers of folks with extensive trauma in their youth. And what we know is those adverse childhood experiences, as the number of those increase, the risk of chronic physical health, mental and emotional health concerns go up pretty dramatically. we also see a community that's struggling with substance use. And so when I think about my friends and family who identify as part of the community, finding those safe spaces to connect and form meaningful relationships in places that don't have a real focus on alcohol use. And so that's an ongoing struggle for the community. And the last thing I'll point out is that loneliness continues to be a pretty significant problem in the community. And I know this year Mental Health Action Day is really focused on building connection. And that's something that at Envision U that we're really committed to undertaking, is building programs that are inclusive and supportive to building meaningful connections for folks in our Colorado's LGBTQ community.
Stephen, thank you so much for that. I appreciate it. Dr. Lau, I want to talk to you a little bit about this. I know last May, Children's Hospital Colorado had declared a state of emergency in youth mental health. It was the first in the 117-year history of the hospital system. Pediatric emergency departments, inpatient units, we know, were overrun with kids that were showing up and they were attempting suicide and suffering from all kinds of forms of major mental health illness. Dr. Lau, a year later, the numbers are really going up, with children seeing double the number of the mental health patients that are coming in there. How do you handle this? Do you have the staff in order to take this on?
Yeah, thanks so much, Karen, for pointing out sort of the youth mental health needs of our state. It is still a mental health crisis, and I actually joined the Children's Hospital team in September of last year. When right before the National Pediatric Youth Mental Health Crisis was declared by the American Academy of Pediatrics, American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association. As you mentioned, we have been seeing double the amount of kids still from our 2019 dates and numbers. In our emergency departments, on any given day, half of our trauma beds actually are taken up with kids who are really in crisis with their families, who have may have attempted suicide or have very serious plans or thoughts about harming themselves. Also other conditions, as Steve mentioned, eating disorders, addiction, substance use, depression, anxiety, autism, the whole 9 yards, we're seeing still at record levels in our emergency rooms, but also across our continuum of care. Waitlist for outpatient therapy and assessments, as well as for our inpatient hospital beds, as well as for our partial hospital program and our school-based programs as well. So we're still seeing record numbers and a crisis level of care and a huge workforce shortage. And I think Dr. Metlock and Steve probably can agree with us on this. I think across our mental health system in Colorado and really around the country, we saw a huge turnover in our mental health workforce, as well as sort of shortages in the pipelines.
Dr. Liao, I want to talk more about all those things coming up here in just a few minutes. We're going to go to a quick break. We'll be right back with more of our community conversation. Mental health is health. Welcome back to Mental Health is Health, our segment that we're specializing on today, our community conversation. Joining us again is a Behavioral Health Commissioner for the state of Colorado, Dr. Morgan Medlock, the Chief of Mental Health at Children's Hospital Colorado, Dr. Ronly Liao, and Steve Hayden, who is with Envision U, a nonprofit that focuses on improving the behavioral health for Colorado's LGBTQ plus community. We appreciate and are so grateful that all of you could join us for this conversation today. Such an important conversation. Steve, I want to start with you and talk a little bit more. We had hit on this topic a few minutes ago about suicide, and mental health covers a vast array of issues and emotions going on, but suicide, of course, it seems to impact so many right now across our state. Let's talk a little bit more about that, if you would, about what you're seeing and what you would like to see change and helped with this.
Sure, Karen. So in addition to my role as CEO of Envision U, I'm also a mental health therapist. So I'm seeing it in my private practice as well as in the data that we've collected in our research. So what we know over the past year, LGBTQ youth, nearly 50% had indicated they had serious thoughts of killing themselves. And that is a heartbreaking statistic. When I think about the number of young people, and sadly, the second leading cause of death among all youth ages 10 to 24 is suicide. To think that there's that level of despair and hopelessness among our youth in this country is really troubling. And connecting those young people to meaningful care is an important priority, I know, for all of the panelists on today's discussion. It's something that we continue to focus a lot of our efforts on. With those heartbreaking statistics and the need to increase the size of our provider workforce, we'll begin to be able to address that, and I think in a more meaningful way.
Dr. Liao, I want to ask you too. You had mentioned that we don't have a system for child mental health care here in Colorado, and talking about the youth suicide rate, we know it's a huge problem here in Colorado. We can't seem to get ahead of it and reach our children the way that we need to reach them. What do you think? What do you think is the next step? Where do you think we need to go to break into this? I know clearly the school districts, we have to find a way to work better with our schools as well.
Yeah, I appreciate that question, Karen. And just to piggyback on what Stephen just mentioned, so in Colorado, actually, suicide is the #1 cause of death, beginning at age 10, which is really shocking. I have a 10-year-old at home, and I think when we thinking about suicide, those rates are increasing fastest and highest for the younger kids, actually, in that 9, 10, 11, 12 age range. And again, that disparity that we're seeing in higher risk in Black and Brown communities and Native populations and tribal nations, as well as Steve mentioned, LGBTQ youth, some of the highest rates we're seeing rising. So that's of a concern. I have been quoted in saying that I don't feel that actually any state has a youth mental health system of care that we have truly invested in. If you think about where I'm sitting now at the Children's Hospital of Colorado, we have state of the art, sort of world-class, best in class children's health care for physical conditions. And we're working our way towards best in class for mental health conditions. But if you really look at the investments that have been made, not just at the state level and local levels, but also at the federal level in the country around mental health infrastructure and safety nets and prevention and a system of care that involves early intervention and identification in places where kids live and work and play and connect. So that's in schools, as well as in their pediatricians and family practice offices, as well as in their communities and neighborhoods. So we're working really hard in our 5-year strategic plan to make those investments in prevention, early intervention, and partnerships with community partners who also are investing in mental health. And I do have to applaud the state of Colorado in this last legislative session and Governor Polis and Dr. Metlock and the new BHA, because Colorado is going to be doubling down and making huge investments through ARPA funds and other legislative funds in building a mental health system for children in Colorado and their families.
Dr. Medlock, let's go to you and share a little bit now that you're in charge of the behavioral health program here. What are your thoughts on this, and what are you desirous of seeing?
Well, certainly Governor Polis and I have certainly prioritized support for a robust youth mental health system. I do want to just highlight what Dr. Liao just called out around investments being made this legislative session. First, we are extremely proud that we're able to continue the I Matter program, which again, for parents who are watching, that provides free therapy for any youth in Colorado. Really critical that funding has been extended. Also want to highlight that we're bringing online more beds for kids, specifically kids who are struggling with what we call neuropsychiatric issues. Many of those kids historically have had to go out of state to receive appropriate care. We've also invested in youth respite services, youth substance use disorder services, and a range of services to support children and youth across the continuum. I also want to highlight that my administration will be adding a senior advisor for children, youth, and families, someone who will report directly to me as commissioner and will serve as a system-wide strategist for how do we really begin to build the system of care that's people-focused for children, youth, and families.
Listening to each one of you talk and share here, I definitely feel I'm optimistic about the future of mental health here in Colorado, especially for our youth. I know, Dr. Liao, you had mentioned there about your child, and I have an 11-year-old too, and it's something that we talk a lot about. Mental health is so important, and trying to find ways to stay healthy in that, in light of all the daily struggles and stresses that our young people have. It's certainly a challenge, and it's just fantastic that the state of Colorado is taking on this challenge and certainly wants to make a difference. We're going to get back to our segment here in just a few minutes. We're going to take another quick break, more of our conversation on mental health when we return. Welcome back to our community conversation on mental health is health. We so appreciate each and every one of you for being here with us today. We're highlighting how mental health is so important. We're talking to Behavioral Health Commissioner for the state of Colorado, Dr. Morgan Medlock, the Chief of Mental Health at Children's Hospital Colorado, Dr. Ronlee Liao, and Steve Hayden, who is with Envision You, a nonprofit that focuses on improving behavioral health for Colorado's LGBTQ plus community. We are so grateful to have each and every one of you with us today talking about mental health. So important, and really something that we should all be talking about with our families and our neighbors, and certainly our communities that we're inside with. So we appreciate your time for sure. Steve, let's start with you a little bit. Let's talk about the workforce component right now, what you need as we move forward, your access to more employees, and what you want that employee pool to look for and why it's important.
So in terms of the workforce to meet the needs of all Coloradoans, including those that identify as LGBTQ+, the first thing is making sure that our providers have the requisite training to deliver that affirming and culturally relevant care. So at Envision You, we have a comprehensive training program to make sure that our provider networks can deliver high quality care. The second piece is expanding the workforce. So what we've seen is a pretty significant attrition rate in the field and a lower enrollments in graduate school programs for folks seeking careers as a mental health professional. So what can we do to increase interest in folks pursuing this career? And then the other piece, which is really vital, is that we have a diverse workforce, one that represents and looks like the people that we serve, live in communities, understand the unique challenges that communities of color, members of the LGBTQ plus community, Indigenous folks, and others who are often have greater needs and less access to care. So I know at Envision You, we've been involved in some of the workforce development efforts underway at the state of Colorado, and look forward to continuing to partner with our state leaders to ensure that we have a diverse workforce.
Let's get over to Dr. How things stay within your own workforce and what areas you need to build on.
Yes, as Steve mentioned, we've had probably 30+% turnover in the mental health workforce, and that's nationwide. And so we've really made a concerted effort in really investing in our pathway programs. So from our nursing pathway programs to our master's clinician pathway programs, including peer support specialists. So these are families or youth with lived experience of mental health challenges, which we're building a certification program so that they can also join a community mental health workforce. And I think that's where, when you have 30% workforce turnover in a whole field, it really gives us the opportunity to recruit from places that we traditionally wouldn't look and create something like a mental health service course. So folks in the local community can really think about meaningful careers to develop in and have mentorship and supervision and coaching and support in a peer group as well. So we're looking at lots of incentives through Children's Hospital Colorado, as well as the CU Anschutz Health Sciences Campus, to partner with community colleges through pre-K to 12 education to think about early, like pre-K to career pathways in mental health, engaging the whole family, whole school communities as well.
Thank you so much, Dr. Medlock. I want to ask you too. I know that you are. This is top on your radar, of course, as far as having a workforce committee and administration here to push these efforts forward. What does that look like for you and your department?
Absolutely. Workforce is one of our 6 pillars of transformation within the Behavioral Health Administration. And we are actually speaking to both issues that have been raised by my colleagues today. In terms of training, the Behavioral Health Administration will be launching a learning management system that all providers across the state can utilize to access training in equity, cultural humility, and other topics that are critical for serving Coloradans in the way they deserve. In terms of actually building the pipeline, we also have dollars that have been allocated this legislative session to help us do just that. And I'm excited that as a first step towards our workforce development strategy, we have actually hired a workforce development policy officer. And this executive will be joining our administration in mid-June and will be responsible for releasing our workforce development strategy by September 1.
That's fantastic. Dr. Medlock, thank you so much for that. We have about a minute and a half, 2 minutes here. And quickly, I just wanted to go through each of you and just ask you, as just a part of the community, as a neighbor, as a mom, as a friend and family, and someone that loves the community, how can we, Coloradans as a whole, how can we help in this process? Dr. Medlock, I'll start with you. How do we help out, and how do we start this conversation?
Well, I am most excited about the advisory council, the lived experience council that will really drive the co-creation of an equitable, accountable, and effective behavioral health system in Colorado. I wrote an op-ed earlier this month that includes a link to how to apply for the advisory council. And so encourage everyone to look on the Human Services website, look for the BHA Advisory Council, and you will see the application there on how to join our council. We hope that a majority of individuals with lived experience, including family members or those who have themselves had mental health challenges and needed to access services, that you will join this really critical council. Help us create the ideal system.
That's fantastic, Dr. Medlock. Thank you. Dr. Liao, you next, if you don't mind. Just share with us how we can start that conversation with their youth.
Yeah, Karen, I always wear two hats. So one is a child psychiatrist, another is a parent. And I think it's been a really long 3 years through the COVID pandemic. And we saw the mental health sort of rising rates and levels of crises even before. I think one of the first things to do also is just to remember to take care of yourself and look around at the children, because all of the children in Colorado are part of our larger family in the state. And I think when we've been so isolated, as Stephen has mentioned, there's really been, I mean, it's really been a really very challenging time. The people that you would have turned to usually, we've had to social distance and been disconnected from. We have a whole host of parent resources on our Children's Hospital website, as well as advocacy tips and guidance too, if you want to work to advocate at your local or state and community levels, or at the national level for a more robust investment in children's mental health. So I think the first thing is just to take a collective breath, enjoy this end of the school year if we can, as parents and family members and physicians and healthcare workers and mental health care folks, because it's been a long haul. So
it sure has. Dr. Liao, thank you so much. We appreciate all of you being with us. Drs. Medlock, Liao, Mr. Hayden, for sharing your insights with us today. We appreciate your time and your dedication. And to access more resources, we sure hope you'll visit cbsdenver.com. Find the Mental Health is Health section on there. Once you get there, you'll see stories about how groups in our community are helping others thrive. You're watching CBS News Colorado. Your top stories and weather coming up next.